Okay, today we are here to talk about exam two. We are group number five. And does anybody want to start us off for the first person?
I can go.
Yeah. Okay.
I did how I did. So I did a little bit better than I did the last time. I think there were a lot of similar questions, so that I had recently refreshed. So that was helpful. I felt a little bit better, but I guess that kind of goes into surprises and disappointments are kind of the same thing. So surprises was like how much CR stuff I don't remember, even though like on exam one, we just went over some of that stuff and I was like, oh yeah. And then on exam two, I was still like, wait, is it amorphous selenium or silicon? Like, I'm not sure. And I'm having a hard time remembering those things. So it was disappointing that some of that stuff didn't stick in. I don't know that I had any revelations per se. Um, but the question that I got wrong twice is kind of embarrassing because it's an anatomy question. But it says which tarsal bone articulates with the third metatarsal, and I know which one it is. I can see like the foot in my mind, but I always say the medial because it's in like the more I say that every time, even though
Yeah.
it's the lateral. Like, and I know that, but just it feels like it's in the middle of the foot for
Yeah.
me. So I got it wrong on the both times that I did this, and I was like, this is such a simple question. Um, so what that really means to me is I need to slow down and think. Like I know it's the middle of the foot, but it is the lateral cuneiform. So that was kind of my experience, but it was a little easier sitting there through the questions. I was able to focus better. I think just getting used to taking tests for that period of time uninterrupted. So I think it was good overall.
There's a lot of questions, definitely. And
Yeah,
I think the CR stuff is like it's hard.
hard.
We're not using it, like
Hmm.
we don't at my location anyway. So
Yeah,
it's like you're
Not
not
mine
like
either.
a lot of
getting
similar names too for the CR stuff.
yeah,
Exactly.
It's kind of
seriously.
confusing.
So it's I guess we're just gonna figure out a way to memorize it
Mhm.
or like remember the difference between the two.
Yeah.
Anybody else want to go next?
Yeah, I'll go. So I did like 10% better. I mean, it
Nice.
still wasn't that great, but
Hey,
it's in the right
still
Progress is
direction.
better.
progress.
Yeah.
Yeah. Um, I felt like this test was a little bit more difficult. Um, I'm not sure why, but there were just some questions that just kind of surprised me. Um, Yeah, just a few of them. And then I was disappointed in my image production section. I was still scoring kind of low on that one. My revelations is that I just still need to study a whole lot more, basically everything overall. One of the questions that got me was the KVP range for synthetic or
Oh yeah.
patients for ribs over the diaphragm, and it
Yeah.
Mm.
was a 75 kVp through 80. Uh, I just wasn't able to remember that. So that's the one that got me.
Did it say why? Do you remember saying why it said?
I'm not sure why.
Yeah, I don't
Yeah.
remember either.
I also got that wrong the first time. I think I said I thought it was 65 to 70.
Yeah.
Yeah. I get confused with the body
But I
hazard.
think that's what, yeah, I don't know.
But,
Yeah.
You want to go, Andrew, or you want me to go?
Yeah. I'll go ahead and go. I did better on this one as well. I got a 9% increase, so it
Me?
was, yeah, I wasn't too bummed about that. Like I got the score at the end and I was like, I'll take it. I
Yeah.
was like,
Yeah,
great.
that's
Um,
awesome.
yeah, thank you. How I felt about it, yeah, I definitely felt a little more um excited and like a little more prepared. Like even though I kind of go through these, ups and downs of feeling prepared for the actual exam because it's getting closer, but also like I feel like I don't know, like I feel like I'm studying enough, but then I am always, at the back of my head, just like what if it's not enough?
Same.
Um, and then what surprises I encountered, there were a few questions that were just like, um, they were just kind of odd. Like there was one
Fun.
that was about like, let's see, it was when the radiologist asks you to take the vitals of a patient
yeah.
Oh,
and where to write the results.
That was a strange question too. I was like, what? Like what?
yeah.
I think I got it
Yeah.
wrong too at first because I was like, oh, well, in the patient's record
Chart. Yeah.
chart, but that wasn't the answer. It was something else. It was like on their,
On their rec. I don't
yeah.
Yeah,
think
they
that
want you to
we're
write a
allowed
request
to
form.
write on their
Yeah,
chart.
I don't think so.
Oh, okay. Yeah, well,
Okay. And then there was one that was like about the correct
Baba.
moving, like way to move something that was heavy from one side of your
Oh,
body to the other.
yeah, move your feet. I was like, well, I'm assuming they don't want us to twist anything, so I picked move my feet.
Yeah.
I don't know.
I think that was like a patient care.
Yeah, one of the first semesters
I
or
mean, it
second
makes
semester.
Yeah,
sense, but like
just
I don't know. In the
random.
moment, I was just like, it was unexpected because I was like, I'm getting asked questions about like CR, like we were just talking about, and positioning and central rays, and I was just like, moving a heavy object from one what?
Yeah.
Yeah, it's
So,
kind of
Seemed like
random.
very random question. And the disappointments is I just got like a hair under a full 10% of
almost
improvement.
there. You're almost there.
Almost there.
One more time.
Um, one more, yeah. Which I didn't realize that we had to do another exam too by today, and it has to be above 90%. It's like, ooh.
Yeah.
But the revelations, yeah, I guess that kind of covered that. And yeah, I think the next round I will study the CR like you guys were talking about a little more, kind of get more familiar with that and like the X-ray tube and circuit.
Yeah. Review.
Mm-hmm.
Okay. Thank you, Andrew.
Mm-hmm.
How I did surprisingly a lot better than my first try.
Nice.
I think I just actually tried to look at stuff before we took it, like study a little bit more, just like a quick refresher. So I felt better. But I'm like you, Andrew. I feel like it's kind of a little bit of like ups and downs. Like some days I'm like, am I even gonna pass this board? Like,
Mm-hmm.
am I even gonna make it to the end of the program? It's like it's just like all becoming very real. Um,
Yeah.
some of the surprises I encountered, I would say some of the patient care questions I think are just worded really like funky and weird. I'm like, it just seems like it should be common sense, but then it's just, I don't know. Those questions just throw me off. Um, the disappointments I encountered was also some of the CR stuff, like, or not CR, but CR stuff, like thinking I remembered more than I did. Um, so I guess Revelations is just keep studying. I know that this correct tech is hopefully going to keep us like way over prepared.
Mm.
And one of the questions that I had was about the grid frequency for CR. It's like grids are used or grids use CR must have grid frequency higher than 150 times. And I guess I just forgot about learning that. So
Yeah, I didn't know that one either.
Yeah,
Oh,
me
yeah,
either.
me too.
now that I got it wrong, I'm gonna remember it. So,
Yeah.
you know. Um, but yeah, so I think congrats to all of us. We did better.
Yeah.
We're
Yay.
gonna make it through. We only have what, 60 more days? 65
Something
more?
like that. I
Something
think.
like that.
Yeah.
Let's
And that's
see.
not counting spring break, so that's exciting. Or spring break is in that.
It
Yeah.
is in that.
Okay. So then really less days.
Yeah.
Ugh. But, okay.
We're gonna be fine.
We're gonna get
We're gonna
it.
be
We're gonna
fine.
do this. Yes. But okay. Well, I will go ahead and stop recording then. If I can find the button.